Duduzile Ntsibande.
And I'm Trisha Ramraj.
We are both researchers in the Health Systems Research Unit of the South African Medical Research Council. We'll speak about a study that our team hopes to embark on in your province. The title of the study is Assessment of the Utility of PMTCT Program Data for HIV Sentinel Surveillance Amongst Pregnant Women. PMTCT stands for Prevention of Mother-to-Child Transmission of HIV. This video provides detailed information about the antenatal PMTCT comparison survey, which we are proposing to conduct in all 9 provinces. We will explain the aims and objectives, the approach, activities involved, study timelines, and plans to disseminate findings. The ANC PMTCT comparison survey is a national study led by the South African Medical Research Council, working in collaboration with the National Department of Health, the Centers for Disease Control and Prevention, the National Institute of Communicable Diseases, a division of the National Health Laboratory Services, and Epicenter, a company that specializes in public health research and fieldwork. In South Africa, about 7 million people are living with HIV. Over the last 25 years, the antenatal HIV sentinel surveillance, referred to in this video as ANSU, has provided data to track antenatal HIV prevalence in South Africa. It uses an anonymous blood obtained from pregnant women attending public health facilities. That is, the testing is unlinked and anonymous. With increasing PMTCT coverage, there is a growing concern about conducting unlinked anonymous HIV testing during routine antenatal surveys. Thus, alternative surveillance methods to track HIV prevalence are being considered. Many countries in Africa have moved towards using routine PMTCT data to monitor national HIV prevalence.
The concerns about ANSUR are high cost of survey implementation, high cost of duplicate HIV testing, ANSUR and routine HIV testing, timing, HIV prevalence only measured once during pregnancy, just during the 2nd trimester, ethics, there's no chance to opt out and no consent, anonymity, results are not returned to clients, thus there's no referral or continuity, representativeness, sites may not be representative. Before using routine PMTCT data for HIV surveillance in South Africa, we need to know the quality and completeness of routine HIV testing data and procedures. So the research question in this study is, can routine PMTCT data on antenatal HIV seropositivity be used to track HIV prevalence amongst pregnant women? The overall objective of the study is to assess whether routine PMTCT program data from the District Health Information System can be used for HIV sentinel surveillance amongst pregnant women.
There are 3 activities and 3 specific objectives. During Activity 1, we aim to compare prevalence estimates from ANSU with routine PMTCT HIV results obtained from sites testing, not from self-reported results. During Activity 2, we aim to assess the quality and completeness of routinely collected PMTCT DHIS program data. During Activity 3, we aim to assess the quality of PMTCT HIV rapid testing procedures. This work is important because it's going to tell us, 1, whether HIV test results from ANC PMTCT registers and prevalence estimates from ANSU are comparable. 2, about the quality and completeness of routinely collected antenatal and PMTCT-related DHIS program data. And 3, about the quality of HIV testing procedures. For Activity 1, no data collection will occur during this study. Data for comparison will be obtained from provinces that piloted the revised ANSU data collection tool in 2015. Activities 2 and 3 will be conducted in 360 facilities. We've ensured that the sample for Activities 2 and 3 is representative of a range of national scenarios. That is, all 9 provinces were included, both ANSU and non-ANSU facilities are included, and rural and urban facilities are included. No patients will be interviewed and no patients will be followed up. We'll not be taking any blood from any patients. For Activity 2, We'll interview facility managers or a designated healthcare provider using a site assessment questionnaire to document site procedures for PMTCT HIV testing and data recording. We'll also use a data abstraction tool to conduct a retrospective review of PMTCT-related data from facility-based registers to determine the completeness of routine PMTCT data. For Activity 3, we'll use the PMTCT HIV rapid testing quality assurance assessment checklist to assess the quality of HIV PMTCT rapid testing procedures.
Thus far, we have obtained ethics approval from the SAMRC and the CDC. The National Department of Health has communicated with the provincial heads of health and have given us permission to approach provincial departments of health to obtain approval and discuss potential data collection. We have submitted an online application to each provincial ethics review committee and are awaiting the results. Informed consent will be obtained before data collection from all participants. No patients will be interviewed during the study, and no patient identifying information will be collected during data extraction. Field workers will sign a confidentiality agreement. Pending provincial approval, field work will commence between January and March 2017. The results will be shared with the Department of Health at national and provincial workshops, and the final report will be shared with the national and provincial Department of Health. We request the Provincial Department of Health, including the Provincial Ethics Review Committee, to support and approve the proposed project in writing and to communicate this approval to all districts. We are willing to answer questions and provide any clarification on any aspect of the work. In each province, during the data collection phase, we will be represented by Epicenter. For further information, or if you have any questions that require clarification, please contact Professor Amina Goga, the principal investigator of the study, Ms. Dudizile Nzabande, the project manager, Professor Adrian Purin, a co-investigator from NICD, or Sherry Coward from Epicenter.
Also, feel free to contact any other member of the research team.